And so with that warm welcome, I would like to now invite to the stage my fellow panelists. So our president, Lori Funk-Cirefice, and Michelle Colero, the vice president of the World Bladder Cancer Patient Coalition, and both also leaders in their respective organizations in France and Canada.
Doesn't that look like Find Michelle in that picture? Like, where's Waldo? Where's Michelle?
It's way too small from up here.
It is. So welcome everybody, everyone in the room and participants online. Thank you so much for joining us today. My name is Lori Funk-Cirefice, and you know, I was thinking about 12 years ago, in October actually, I was in the waiting room waiting for a close family member to come back from his very first bladder cancer surgery. Before becoming a patient advocate, I was a carer and still am today. And I was just reflecting on these past 12 years, how amazing the connection has been becoming a part of the bladder cancer international community. Back then, there was no patient organization in France, and I joined Fight Bladder Cancer in the UK, where I received amazing support for my own journey. Later on, I joined Bladder Cancer France in 2017, and we were receiving support from the leaders of Fight Bladder Cancer, actually. And this is really part of what we do here at the World Bladder Cancer Patient Coalition, is we support new patient advocates, fledgling patient advocacy organizations in any form. And I must say that over the years, Fight Bladder Cancer, the World Bladder Cancer Patient Coalition, and many other patient advocates have supported us. And I just wanted to share that with you because it's in the spirit of everything we do here at the coalition. Our purpose is really simple yet powerful. We want to foster an international community of people affected by bladder cancer, to advocate for access to the best possible information, support, and care, and to build strong alliances with health professionals, policymakers, researchers, and industry. Collaboration is what makes progress possible, whether through awareness, education, advocacy. Everything we do at the coalition is about uniting this community so that no one faces bladder cancer alone. Okay, thank you. So I just want to start out by talking about our members, the organizations that make up this coalition. You can see on the map here that today the World Bladder Cancer Patient Coalition brings together 17 member organizations across 6 continents. We represent patients, carers, and advocates from around the world, and it's very exciting to see so many of you here with us in Brussels this week. Each organization, big or small, new or established, works tirelessly in its own country to raise awareness, to support patients, and strengthen advocacy. And together, they form one connected global community. What makes our coalition unique is how we collaborate. Our members, we share knowledge, we learn from each other on a daily basis. We support each other's growth so that every national effort helps even more patients and contributes to a stronger global community and movement. As we look around at the community that we've built, it's also time to look ahead, and our coalition keeps growing every year. This brings new opportunities, new challenges, and a shared responsibility to shape the future of bladder cancer advocacy. And that's exactly what our new strategy for 2030 is about. It's about setting a clear direction for where we want to go and how we're going to get there. And I will now hand this over to Michelle, who's going to dive into the details of our new vision and mission.
Thank you, Lori. So reflecting back to Lori's reflection I am also a caregiver, or I was a caregiver for my grandfather. So we emigrated from Italy to Canada, and we're not going to be the 51st state, but regardless. And when he came over, he started a dry cleaning business, and the chemicals and fumes from that dry cleaning business, unfortunately, he was diagnosed with bladder cancer. And back then there wasn't BCG. We didn't have the first line treatment. And now, being just one little cog in the wheel of providing amazing potential and treatment brings me joy every day. But on to the official task at hand. So Strategy 2030 seems so far away, and yet it isn't. But it's a new chapter of where we want to go and how we're going to get there. Last year, we reflected on the past 5 years of work. 5 years. That's impressive. Work and achievements to shape a clear roadmap to 2030. Strategy was developed thanks to many of those member organizations and partners in the room. And our vision is simple but ambitious. A world where the challenges of bladder cancer are defeated. That's awesome. And we're going to do it. So how are we going to do it? Our mission will explain what it looks like, and we're committed to writing and empowering the global bladder cancer community through collaboration, advocacy, and collective action to improve outcomes for everyone affected. And what makes the coalition unique is our ability to connect local realities and real needs with opportunities for global action. Through our work, we coordinate collective efforts on challenges such as awareness, research, and access to care. We support the creation and growth of national bladder cancer organizations, especially in countries where there's not yet a patient voice. We empower our members through shared learning, tools, and resources, and make sure the patients' voices are heard in the decisions that affect them, whether in research, innovation, or health policy around the world. Now for more specific information. So this renewed mission will guide everything we do, from awareness campaigns to partnerships and advocacy, ensuring that every action brings us closer to better outcomes for people affected by bladder cancer. And as I said, we're not available to me and my family. So to turn our vision into action, we've defined 4 strategic objectives that'll guide our work through 2030. First, we'll focus on raising awareness about bladder cancer globally to encourage timely diagnosis and help reduce the burden of the disease. Second, we will grow our membership so that our coalition reflects the diversity of the global bladder cancer patient community with strong representation from every region, from Europe to Africa, Latin America to Asia Pacific. Third, we will continue to empower our members, helping them strengthen their organizations and advocate effectively in their own countries, building partnerships and delivering the best possible support to people affected by bladder cancer. And fourth, we will focus on influencing decisions, ensuring that the patient voice is included where it matters most, from research to policy change and care delivery. Together, these 4 objectives bring our mission to life, supported by an overarching focus on good governance and collaboration. They will guide how we work as a coalition and ensure that the next 5 years of action will lead to real progress for bladder cancer patients around the world. And I'll now hand it over to Alex, who'll share more about the policy and advocacy initiatives.
Thank you so much, Michelle, and thank you, Lori. And it's exciting to look ahead to 2030. I know it seems like it's far away, but now we have a clear direction how we're going to get there and what we need to do to get there. So I have just a couple of slides before we have an opportunity to share some perspectives on some of the work that we have done so far. And as you have both sort of alluded to, everything we do begins with listening to people that we represent. And we believe that without the evidence and without the evidence that from our community, listening to our community, it's hard to design care and policies that truly meet their needs. And that's why A few years ago now, in 2023, we published the Global Bladder Cancer Patient and Carer Survey, which was the first time that we had an opportunity to look at the bladder cancer patient care journey and different steps along the way and what their experiences were from their point of view, as well as for the first time looking at bladder cancer care experiences uniquely as well. And so the findings revealed some clear challenges: that awareness was still low and more than half of respondents to the survey haven't heard of bladder cancer prior to their diagnosis. There was delays in diagnosis that were quite common, and especially in women or younger patients as well. Emotional support was lacking, and many patients also faced financial difficulties. And all these areas require action, which we can collectively, not just the patient community, but actually all stakeholders, many of you who are in the room, need to work together to change that. So that is the foundation of everything that we do. And so from that was one of the major milestones in our advocacy work where we began was the white paper on bladder cancer. This was a project that we had launched with the European Association of Urology, who is our long-term partner. And it was the very first time that we had, as a bladder cancer patient community, and we're able to represent a comprehensive set of policy recommendations that are important to our community at the European level. And whilst the white paper is European, it's the first stepping stone for us for broader advocacy work globally as well. And the white paper called for many recommendations across the board, and you have also a few of the leaflets on the tables and in the program information pack as well, where you can access it online to have a look at these in more detail. But so our advocacy doesn't stop there. And so when we launched this white paper, we had our first event here in the European Parliament that year, hosted by MEP István Ujhelyi and Lori, you were there, and quite a couple of our patient advocates were there as well, sharing their personal experiences. And this roundtable was an opportunity for us to start that policy dialogue through the white paper and bring those perspectives into the policy discussions. And so earlier this year, we had, as we had a new European Parliament cohort, starting just late last year. So for those who are outside of Europe, there were elections previous year, and so we started quite a new number of new members of European Parliament. So it's an opportunity for us to present these issues to new people, to socialize them to bladder cancer challenges, both from patient perspective, but also together with the European Association of Urology on the clinician's perspective too. So we had a wonderful opportunity to do that. And we had two of our community members, Pete Klein and Melanie Costin, who joined us here in Brussels. And they are in the room here today as well, so you have an opportunity to meet them. And later today, we'll also have an MEP joining us towards the end of the day for a closing keynote here in person. And we take that, as I said, this is a European policy work that we have done. We are based in Brussels, so it's a good stepping stone for us to start from. But we take all these findings from the patient survey, and we've really presented this at a number of international congresses, working with healthcare professionals across the world to socialize the findings and give more visibility to these challenges that our community faces. And so now I wanted to come to both of you, Lori and Michelle, with a bit of a personal reflections on the future, how we're getting there. And Lori, you spoke about who we are as a coalition, a global community built on collaboration. So how do you think this strong sense of community will help us reach those 2030 goals that Michelle presented?
Well, Alex, with a strong sense of community, our members feel engaged and supported. Because it takes a lot of effort to advocate at the national level and to be involved in these international subjects as well. Being a patient advocate, running a national organization, it can be a lonely place sometimes, and it's really amazing to feel supported and surrounded by other like-minded people. And that keeps us going, knowing that we're not alone out there. Just as bladder cancer patients shouldn't go through their journey alone. Patient advocates also shouldn't go through it alone. So I think that's really what our sense of community is about, is keeping each other energized and focused on why we're all here. The more support and training that we can provide as a coalition to our members, and even our members' when possible, it will just empower us even more and make us the best possible advocates that we can be, to carry out our activities in our countries, and also to influence national policy when we're trying to, and as well as influence the global themes that are common to all of us.
Thank you, Lori. And yesterday we spent quite a bit of time focusing on policy and advocacy areas and health technology assessment, really looking at empowering our members with that knowledge needed to participate in these discussions, and also appreciate the time and effort that it takes to actually to come and spend that time to learn. So Michelle, a big part of our work is helping our members and helping them grow and drive the support locally. How do you see us as the coalition empowering members even more in the next few years?
Oh, then that's a great question. And I see us more supporting knowledge sharing. For example, we, as Angela had said yesterday, we created a hematuria brochure, but that started from Australia. So let's look at what others do, maybe not reinvent the wheel, as the first keynote had mentioned, and find ways that we can maybe just pivot a little bit and add to that awareness. From peer support, sometimes you need fresh ideas on what to run at a peer support meeting, or your programs. And we can all learn and just think about where we can collaborate and continue to collaborate, as we've done so well in the last 5 years, and look at things that we can borrow. Our Healthy Living our Healthy Living Guidebook was actually a Canadianized version of what Melanie and the team at Fight Back did. You know, so why recreate the wheel? We've got all these brilliant minds in the room and also online. Let's use that and build from that and find new opportunities.
Amazing. I fully agree with that. And I think this is an opportunity when we're all here in the room for us as a coalition to draw as well where we can best support our member organizations, what are some of the initiatives that we can collectively do. And so hope today there's quite a bit of policy discussions that we get that inspiration to our members as well. And so I'd like to pose to all three of us sort of the final question. If we were to jump ahead and we return in 5 years back to Brussels in 2030, and we were sitting on the stage again, what is one thing do you hope we will have achieved as a coalition by then? And Lori, maybe let's go with you first.
I really hope that in 5 years from now, we'll be seeing even more new faces and new members from all around the world. I'm always really excited to welcome new members and think about how we can support them and going forward, knowing that we're just growing our community and that more and more patients around the world have an opportunity to benefit from support.
And Michelle?
She took my answer. Darn it, I have to come up with another one. No, in all fairness, that is very true, and I agree with you, Lori. But it's also ensuring we provide patient support in even more languages. You know, we in Canada are diverse, and I'm always asking, do you have a guidebook in Arabic? Do someone have some information in other languages? So hopefully we'll be able to offer it in even more languages, building upon what Lori was saying about adding new members.
Fantastic. And from my own perspective, I would say that we have a great growing interest in policy and advocacy from our members and to support them on that journey. So I hope that by 2030 we have more bladder cancer focus in national cancer plans in many countries that our members represent. And I think that would be quite a big achievement, making sure that bladder cancer has the attention it deserves in national policy. And we can also do that at more regional and global level. And so this session is recorded, so we will have some accountability in 5 years to look back whether we did achieve that. And I think we have the drive and interest to do that. So I would like to thank you both for joining me for this discussion, and I invite everyone as well to, if we can give a round of applause to our wonderful leadership.